next month is Psoriasis Awareness Month, and my next guest, Seeger, is one of the 7 million Americans suffering from psoriasis, a painful condition that often comes with a very real stigma attached.
I'm the 26-year-old mother of 2, and I've been struggling with severe plaque psoriasis for almost 7 years. I suffer from this condition on my hands, my knees, my arms, my chest, my scalp, my face. I think and obsess about it all the time. It drives me crazy. On a daily basis, I have to take into consideration my psoriasis. I wear my hair big to conceal my psoriasis on my scalp. I don't want people to have to look at my psoriasis on my scalp, and that's all that you can see, especially around my face and all right here where I part my hair. I don't like to pull my hair up in a ponytail because I don't like people to see my psoriasis on my ears. My ears will start bleeding. It's pretty bad. Picking clothes out every day is a struggle. I constantly have to make sure that my sleeves are long enough, or if I do wear shorts, they go to my knees. And I avoid wearing dark colored clothing to avoid my psoriasis flakes from my scalp falling down all over me. I'm teaching my daughter that everybody is beautiful inside and out, and I wonder how I can be a good role model for her when I don't feel that way about myself.
Well, on the tape with Seeger, and I thank you for being here, because this is something you kind of hide from, right?
Yes. Yes.
And you're not hiding, you're out here talking about it. And also joining us to talk about psoriasis is our very good friend, Dr. Frieda Lewis Hall, Chief Medical Officer of Pfizer. Dr. Take us through this. Talk about psoriasis. What is it? What do we need to know?
Psoriasis is a chronic inflammatory disease. Basically what happens is your immune system mistakenly instructs skin cells to grow too quickly. And those overgrown cells collect in patches, or things we call plaques. And these plaques can be anywhere over your body. And frequently, as Seeger told us, the scalp, the elbows, the knees, and your torso or your chest are the common places. And you just mentioned that sometimes people are afraid that they might catch your psoriasis.
Yes, they either think it's an infection or have some sort of like crazy disease. They don't know what it is.
In fairness to people, if they don't know, do people, if they're around someone that has this condition, do they need to be scared? Is it contagious?
Well, this is the perfect time to set the record straight. No. Psoriasis is not contagious. Not contagious. You can't catch it. In fact, research suggests that in order to actually develop psoriasis, a person has to have a genetic predisposition and also exposure to a trigger. And that trigger can be something like stress, an infection, an injury to the skin, or even certain medicines.
About 40% of people with psoriasis, more so in women, minorities, and young people, really report experiencing social discrimination, like being refused service at hair salons, not being permitted to use public pools. You've felt the sting of this, right?
Yes, I have. I've actually went into a cell phone store, and I was going to pay my bill and asked them a few questions that I had about my phone. And I'd put my hands up on the counter, and the lady that was working just went back for me after she seen my hands when I had a really bad flare-up, and she just went like this and like didn't want to, touch my phone or help me with my stuff. So,
And being judged for how you look is bad enough. Even worse, when being judged has the kind of emotional distress that you just described, but also can aggravate your symptoms. The other thing, as though psoriasis alone is not enough, people with psoriasis also have an increased risk to develop other illnesses: depression, arthritis, heart disease, and diabetes. That's why it is so very important for people who have psoriasis to come forward, to speak out, and to get with a medical team that can help find the best treatment platform that may work for them. And I was really struck by your question. You said, what can I do to be a good role model for my daughter when I have this disease? So, for starters, to have the courage to be here, to tell your story, to help other people, what a wonderful role model that is for your daughter. So you should be really proud of yourself.
Thank you.
In addition, You know, you're working to control all these pieces of psoriasis, so to get as much control over this disease as you can, but you also show the grace to accept those things that you can't and then to deal with those as best as possible. And importantly, and also something that you're doing today, which I think is absolutely critical, is that you are teaching your daughter that how you treat others is as visible and as impactful as any skin disease can be. How beautiful that is. And of course, Dr. Phil, there's so much to know about psoriasis and so many resources that people need. Of course, we invite folks, if they want to know more, to go to gethealthystayhealthy.com.
Yeah. And listen, this gethealthystayhealthy.com is an absolute wealth of information, and they're going to find what they need on psoriasis on this site, as well as a whole lot of other things. And you actually write a blog on here, so we get to hear from you on there as well.
And even better, so you get to hear from me, but there are dozens of experts that contribute to the site. So myself, but other experts.
Yeah. If you haven't been there, it's gethealthystayhealthy.com. Put it on your favorites list. I have it on mine. All right, I'd like to thank all of my guests today, especially Dr. Frida Lewis Hall.